Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas, an expert in the area of personality disorders. And today we're going to talk about interaction patterns and borderline personality disorder and borderline personality disorder traits. And if you enjoy the video, please subscribe or click the bell or click the thumbs up or check out some of my other videos. I think that would be great. And today we're going to talk about passive style, aggressive style, passive-aggressive style, and assertiveness. Now, these four interaction styles are pretty important, and I think that those along the BPD spectrum, I think what happens is they tend to find or are more likely to utilize one or two than the one that is the most healthy. And we will talk about that in this video, and let's get started. Now, the first interaction style, we're going to talk about the passive interaction style. And in this interaction style, what it is, of course, is that you remain this sort of nebulous, unstructured figure in this process. And that is that you wait for someone else to cause the interaction, to drive the interaction to its resolution. That perhaps you don't get invested in a behavioral aspect, in a behavioral way, in the process to move it forward towards a resolution or a conclusion. And what happens with the passive interaction style is that folks end up very anxious. You're waiting for someone else to do something, and all this anxiety starts to build, and all this tension starts to build, and sometimes it can kick off a lot of separation insecurity and a lot of sense of loneliness and fear, which can trigger your core content, which then drives you to your surface structure behaviors. And if they are more passive, then what happens is you're driving yourself backwards, or to remain still, but you're going inwards. And as you go inwards, that can become negative self-talk. That can become doing things that are unhealthy for yourself, is pulling up all of these memories of you should have done this, you should have done that, which pushes you from the act of forgiving yourself to move forward. So this passivity is waiting for someone else to move forward and determine the course of the interaction or the issue. But I think what's more important than that is that you get involved, and we'll talk about that in just a moment. And let's talk about the aggressive style. Now, the aggressive style, I think, is what most folks attribute to individuals along the BPD spectrum. And that aggressive style, I've found the way that it works with my clients along the BPD spectrum is that what happens is that an instance will occur, and then they will engage in a passive style first. Okay, well, he'll do it, she'll do it, he'll do it, well then, and then I'll wait, but I did this, and they should have done that, wouldn't they do this, shouldn't they do this? And then you get this anxiety that continues to build, and it builds and builds, and this anxiousness and separation insecurity and other factors start to become at play, and it becomes so intense that the individual explodes, and the explosion is an aggressive response. Now, does it take weeks and months or days for that tension and everything to build? Nope. Sometimes it can take seconds. For some of my clients, they have that initial instance, right? It's either an emotional button or a trigger, and I'll put the link for that video here, and then and it goes. But inside of them, what's happening is you have this building sequence, and sometimes it's so fast that you have this aggressive response. Now, understand that doesn't mean it's okay to have the aggressive response, because if you use a passive style or an aggressive style, you are at a decreased likelihood to have a positive outcome for yourself. And that's been studied over and over again. Dialectical behavioral therapy is a big component in recognizing that positive behaviors increase the probability of positive outcome. And think about that. So passive and aggressive style, even though that fits with that borderline personality disorder spectrum beliefs and your BPD lens and your core content and your surface structure behaviors, but it's unhealthy. It decreases the probability of that positive outcome. So we don't want to do that. Now, the other style is pulling these two together, and that's the passive-aggressive style. Now, the passive-aggressive style is, of course, that you have an issue and problem, but you circuitously go around causing problems for that individual, so they suffer or are uncomfortable, or you hope to to appear to be inadvertently causing that person to do something. But what happens is, because it is a passive aggressive style, that individual then feels cornered or feels pressured and ends up doing something, more often than not, in my experience, that does not work out well for the passive aggressor, right? For the person who initiated this. Now, there are some people out there who are really good at being passive aggressive, not healthy, not good, but they're skilled at it. I think we have to be careful of those individuals that are really good at it. And if you're good at it and that is your interactive style, I encourage you to challenge yourself to do things differently. Because if you look back, even though you may get some successes, over time, individuals end up feeling very lonely. So that's to consider as well. Now we're going to talk about what is the most advantageous style. And before, right, remember that passive is not good. It puts you, of course, in a bad role. Aggressive puts you in a bad role. Passive aggressive puts you in a bad role. But assertiveness, now assertiveness is critical. Assertiveness, what that does, when you are assertive with your wants and your needs, you are putting what you want and what you need out there in a manner that is confident, clear, okay, because you don't have to people guess. There's no mind reading, okay? I'll put the link for mind reading here, but that there's no mind reading. You're going to be clear and exact in what you hope to get out of the situation, what you want out of the situation. Sometimes we have to be realistic about the situation, what we hope to get. You're not going to win every time. I don't win every time. Sometimes we have to compromise. We have to also take responsibility for the situations that we're in, and sometimes these are difficult. I certainly understand that, but it's important to do that, to be assertive, to communicate what your wants and needs are, but also recognize that for folks along the BPD spectrum, they don't feel like they are worthy of being assertive. They feel like they deserve passive treatment, which is being ignored, or is people not being involved with them, or so then they build up that tension, then they respond aggressively or passive aggressively, and so on and so forth. But when you're assertive, you're not sitting there sometimes waiting for that other shoe to drop. You're not sitting there waiting for that other person to text you back. You're not sitting there waiting for that email. You're not waiting for something. Now, sometimes we do have to wait. There are things like when you apply for a job, or you apply for a scholarship, or you apply for whatever it may be, or you're hoping someone will call you back. Sometimes there are periods, right? We don't overly assert yourself, which is aggressive, right? To get every need met. Being assertive is a process, is recognize that it is a time, that there's a time component in this. It's about being patient. It's about asserting yourself, asserting your wants, communicating your wants and needs in a way that is clear, but then also allowing that other individual or that other, whatever may be out there, giving them time to respond as well. But you've asserted yourself, and that's enough. That has to become enough. It's not necessarily the response, it's that you put what you wanted out there. And then give yourself a time limit after 3 days, 5 days, 6 days, 10 days, whatever it may be. Then you can do another assertive interaction. But continual assertive interaction, say, well, he said I should just communicate exactly what I want. This is what I want, and I expect an immediate response. That's aggressive. Okay? Assertive is clearly communicating what you want, allowing that other person time to process it too, and allowing that person to respond in a manner that is appropriate as well. Okay? Doesn't mean that you become passive and wait forever. So if some of this is confusing because these different roles can sometimes be complex, there's a lot of assertiveness skill stuff that you can find online. There's a lot of worksheets that you can go through on how assertive approaches, build your sense of assertive approaches that are adaptive, that are healthy, that'll help you reason out interaction patterns. Because if you or someone you love is along that borderline personality disorder spectrum, understand that the way they see situations is likely to be distorted. The way they interact with situations is a lot of times out of fear, shame, guilt, and doubt, and it becomes so much tension and anxiety to resolve the situation and resolve the anxiety that they end up going into maladaptive patterns. So it takes time to learn, to build the skill of assertiveness. But assertiveness is also accompanied by patience and time and reasoning. And I think that it increases the probability of a positive outcome. And it is possible to do it. And I wish you all the best. Please leave a comment on your success with assertiveness, or where you think problems have been in regards to assertiveness for yourself. assertiveness for yourself. And thank you very much for your time and attention. Take care. Bye-bye.